Universidad Católica de Santiago de Guayaquil. Erythrodermia y un nódulo pulmonar. Inglés médico, nombre Adrián López, paralelo D, periodo A 2019, Facultad de Ciencias Médicas. Introducción. La piel puede exhibir la primera evidencia clínica de una enfermedad sistémica y puede proporcionar las primeras pistas para un diagnóstico en hasta el 1% de los tumores malignos internos. La eritrodermia, también conocida como síndrome del hombre rojo o dermatitis exfoliativa, se define como enrojecimiento generalizado y descamación que involucra más del 90% de la superficie corporal. Es una manifestación clínica de una variedad de enfermedades subyacentes que incluyen rara vez tumores sólidos.
A huge differential diagnosis for these nodules. They can be benign or malignant, meaning it could be a cancer. Benign causes can be due to infection or inflammation from a trauma or from something we're just born with. Then there can be malignant causes. The most common type of malignant nodule is an adenocarcinoma. The next most common is called a squamous cell cancer. Other types include a metastatic cancer, meaning a cancer from somewhere else in the body, or also there could be a type called a small cell cancer. So when we find a pulmonary nodule, we need to know what to do with it. The main reason we worry about pulmonary nodules is the possibility of it being a cancer. But the trade-off is we don't want to do unnecessary surgery to take out nodules if they are benign. So there's an algorithm or protocol that we follow to decide how we treat these nodules. The most important thing is to take a history of the patient with a pulmonary nodule. Is the patient a smoker? How old is he or she? Is there a previous history of cancer? Is there an old chest x-ray or old CT scan that shows this nodule? Next, we look at the nodule on chest x-ray or other imaging studies. How does it look? Compare it to other x-rays that the patient has had. Has it grown in size? Has it been stable over the past couple of years? If it has grown, or is a new finding, we will often recommend a CT scan of the chest to better assess the nodule. Other testing that may be done includes something called PET scanning, which can give us additional information about certain characteristics of the nodule. Depending on the findings, if the suspicion is high for malignancy, we may recommend a biopsy. Each method of biopsy has various benefits and risks associated with it, so if biopsy is recommended, these can be discussed with your physician. If our suspicion is not high for any type of cancer, then we would recommend repeat follow-up CT scans over a period of 2 years. Our goal in management of pulmonary nodules is to find a careful balance between attempting to identify and resect early-stage lung cancers, but also to minimize the rate of invasive procedures for treatment of benign pulmonary lesions. Thank you for taking the time to learn about lung nodules. If you have any further questions, please call 1.
Aplicaciones en medicina. Inicialmente fue tratado con terapia de glucocorticoides tópicos, cremas, luego con prednisona oral y antihistamínicos, luego con glucocorticoides intravenosos, pero no tuvo alivio.
About erythrodermic cirrhosis. Now, this is quite a rare form of cirrhosis, quite different from the rest of the other types of cirrhosis you might have known. Again, you might be a sufferer of this condition, or you might know someone. Basically, its common features or symptoms is rising temperature. People who have this condition have got high temperatures, and they tend to use a lot of body fluids and proteins as well. So it's quite a pretty serious condition. It's sometimes very, very life-threatening as well, because if left unmanaged, it leads to hypertension and heart failure also pretty serious. Now, they have been, just like other cirrhosis, is also known to have the itchiness, the redness, and the bleeding, and the face symptoms that comes with it as well. People have been looking for treatment for this condition. However, there's one topical cream, steroid cream I like to recommend for people who have got this condition to test it out. It's called Demesis cirrhosis cream. All you just have to do is apply to the affected area. But the good news is that it's requested for free at the moment to just test it out as a free trial and see if it works for you before committing financially to it. So visit the website on the screen right now and request for a free sample jar to be sent to you to test it out, like I said, before buying it, committing financially to it. So get a free trial, go to the website, and look and hope that you will get a good result. Many people have used it and they begin to get good results in terms of managing this condition. So hope you have a positive result on it.
Pros y contras. Ninguno conocido. Cuestiones en Ecuador. La frecuencia de eritrodermia fue de 0,3. La proporción de sexo hombre-mujer fue de 2,2. La edad promedio de nuestros pacientes fue de 53,78 más 18 años. Se encontraron antecedentes de enfermedad en la piel en 49 de 80 pacientes, 61,2%, y 32 de ellos padecían psoriasis. En conclusión, tenemos que la eritrodermia es una dermatosis multifactorial compleja cuyo pronóstico depende del agente causal, a pesar del hecho de que rara vez aparece como un síndrome planeoplástico, un hallazgo clínico de un eritema que se extiende rápidamente junto con varios grados de descamación, especialmente un paciente sin ningún trastorno dermatológico previo, justificaría una mayor investigación por neoplasias subyacentes, como en este caso extremadamente raro, de caso de erythrodermia asociada a cáncer de pulmón.
Tests and CT scans can reveal abnormalities in the lungs, such as pulmonary nodules, also called lung nodules. It is common for lung nodules to show up when someone is getting screened for lung cancer or during a scan for some other reason. Say if you went to the ER and the lung nodule was picked up. So, what is a lung nodule? A lung nodule is a spot or shadow on an imaging test. Nodules are very common and usually not cancerous. There are different types of lung nodules. The first type is called calcified, which is round in shape and shine brightly on imaging because it is dense with minerals. These types of nodules are usually not cancer. Another type of nodule is solid and is usually round or oblong, and if you cut through it, it would appear solid and fleshy. Another kind of nodule is called non-solid, and it appears hazy, as if you were looking at the Milky Way in the sky or a piece of smashed glass. These nodules are also referred to as ground glass opacities or GGOs. Finally, there's the semi-solid, which also appears hazy and similar to the non-solid nodule on imaging, except with a solid center. Where can they occur? Lung nodules can occur in any area of the lung. The areas of the lung are called lobes. The right lung has 3 lobes, called the right upper lobe, right middle lobe, and the right lower lobe. The left lung has 2 lobes, the left upper lobe and the left lower lobe. What causes lung nodules? Certain conditions in the body can cause lung nodules. These include exposures to something that was inhaled, a condition that is causing inflammation or reaction in the lungs, or infection in the lungs. How do you treat lung nodules? Most lung nodules are monitored over time with CT scans. If the nodules begin to look or behave in a worrisome way, your lung expert may suggest further testing to understand the cause. Developing a strong partnership with your lung expert and following their recommendations for clinical follow-up is the best way to ensure good health outcomes.
Gracias.